Good day. As most of you may know by now, we have crossed the sad and unfortunate threshold in our fight against the spread of the novel coronavirus in the Virgin Islands. I'm saddened to announce that a resident of St. Thomas who died in his home tested positive for COVID-19, making him the territory's first confirmed COVID-19 death. His unfortunate passing makes the territory the last jurisdiction under the U.S. flag to record a death from the coronavirus. The deceased is an 85-year-old male with underlying medical conditions. He unknowingly came into contact with a traveler who was confirmed COVID positive. Our condolences go out to his loved ones, as I imagine this is certainly a difficult time for them, as it is a trying time for all in our community. As with any death, we have withheld his logistical information until his family was adequately notified of his passing. During this time of crisis, we have to make every attempt to stop misinformation in our community. There was a prior report of a COVID-19 related death in St. Croix several weeks ago concerning a resident of Estate Prophet. That gentleman was tested post-mortem after he died, and his test came back negative. Additionally, it was recently reported that a professor at UVI had died as a result of COVID-19 while in Kentucky. All indications suggest that he contracted the virus after he left the territory, and therefore his infection and his death is recorded in the state of Kentucky. Finally, a story this weekend on the VI Consortium posted on Friday evening claimed a COVID-19 related death in St. Croix are totally unfactual and erroneous. We ask that the consortium and other news agencies rely on the VI Department of Health for their information and not tips from anonymous sources. The Brian Roach administration remains committed to transparency and the timely release of accurate information. We do apologize, however, for a typo that was posted on the Department of Health website that misstated the number of tests pending. We have since corrected that. To date, we have 283 individuals for COVID-19 in the territory who have tested in the territory. 222 of those tests came back negative, 43 positive, and we have 20 that are currently awaiting results. 36 of those patients of the 43 have recovered, which means we are currently tracking 6 individuals in the territory with active COVID cases that have been diagnosed, and of course, our 1 fatality. We currently have 1 positive COVID-19 patient hospitalized at the 1F Louis Hospital and 2 COVID patients hospitalized currently at the Roy Lester Schneider Regional Medical Center. One of those patients at RLS is currently on a ventilator. All the others just have oxygen. I would like to remind all of you that if you believe that you have come into contact with the virus, please call 712-6299 or 776-1519, and we will come to you. Please do not go to the hospital unless instructed, as this will pose risk to others in the emergency room seeking treatment for other reasons. However, if you are in need of medical attention, emergency medical attention, call 911 and request an ambulance. Remember, you have to take this seriously. The passing of that gentleman Saturday evening is a grim reminder of how serious this virus is. I want everyone within the sound of my voice to understand this. Any single one of us can contract this virus, and any one of us can suffer serious health consequences, even death. Take this virus very seriously. For the most part, we together, we've been doing a good job as a community, following the DOH and the CDC guidance to help contain the spread of this virus. But we still have some in our community who are not taking this seriously. We have a considerable way to go before we reach our peak, which is not projected to be here for another 2 or 3 weeks. We cannot afford to backtrack on this incredible progress that we have made thus far. And as such, effective today, we are closing all beaches in the territory. This order will remain in effect until Monday, April 20th. The Virgin Islands National Guard will be deployed to support VIPD and DPNR to enforce this order. Once again, we are closing all beaches in the territory for the next 2 weeks, effective today. Our stay-at-home order remains in full effect until April 30th, well, at least until April 30th. We understand that this is Easter weekend, and normally people gather together to celebrate their faith. However, all places of worship must remain closed during this stay-at-home period and this stay-at-home order, at least until April 30th. We do, however, want to applaud the churches and the houses of worship that have found creative ways to allow the members of their congregation to continue practicing their faith during this time of great tribulation via internet, radio, TV, and social media. Essential businesses are still allowed to remain open at this time, but please remember that if you must go out, please practice safe social distancing. But I want you to really concentrate during this period of Easter in just staying at home, remaining in place, and only going out when absolutely necessary so we can nip this thing in the bud once and for all. Before I go, I would really like to say congratulations on a high note to our own Tim Duncan for being inducted into the Basketball Hall of Fame. He has been an icon of everything we hold dear as Virgin Islanders and a true patriot, showing up every single time that we are in need. Finally, we have experienced vandalism and theft at 3 of our public schools this past weekend. While children are at home as a result of this pandemic, we are appealing to the public to report any suspicious activity in and around campuses. Now that the hospitals are starting to see increased activity, I want to take this moment to again thank the nurses and physicians and the support staff that are working diligently to save lives and to keep us healthy. We remain actively engaged in discussions to ensure that our frontline workers are supplied with the necessary protective measures to safeguard themselves and their families from the spread of the virus. The White House is referring to the next 2 weeks as the nation's next 9/11 or Pearl Harbor, one of those dire moments in the country's history. But we can't afford a 9/11, a 9/11, or a Pearl Harbor. We can't afford this in our territory. So I'm appealing to you. Tell your friends, your family, your loved ones to do the right thing and to stay at home for this next period during this Easter vacation, unless you absolutely have to go out. Together we will nip this in the bud. I'm also joined here today by the Commissioner of Health, Commissioner Encarnacion, as well as Senator DeGazon, to share some about what we've been doing to work together on your behalf. Commissioner?
Thank you, Governor. Good afternoon, Virgin Islanders. I, too, want to express my condolences to the family of the gentleman who died as a result of COVID-19. I want to thank my team, the first responders, the epidemiology staff, and the lab staff, and all those who are working with us in an effort to reduce the effect of COVID-19 on our people, our economy, and our community on a whole. As Governor Bryan spoke of, 36 out of 43 persons have recovered, and we have 6 active cases. The definition of recovered: at least 3 days or 72 hours have passed without symptoms of fever, without the use of fever-reducing medications, and improvements in respiratory symptoms, for example, cough, shortness of breath, and of at least 10 days have passed since symptoms first appeared. We are receiving a lot of questions about wearing masks. Last week, the CDC issued new recommendations on the use of face masks during the COVID-19 outbreak. The CDC now recommends wearing simple cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as the grocery store or the pharmacy, especially in areas of significant community spread. The purpose of the new CDC recommendation is to slow the spread of the virus and help keep people healthy, help people who may have the virus and do not know it from transmitting it to others. Those are the asymptomatic cases that we see. The use of face coverings is a voluntary public health measure. We currently have no mandates to wear masks. However, we do recommend that you utilize a face mask if you are ill or if you will be in close contact with someone that is elderly or has a compromised immune system. The idea is for asymptomatic people to avoid spreading the virus to others. Cloth masks are not considered an effective measure for yourself for protecting you from contracting the virus to yourself or to others. The cloth face coverings recommended are not surgical masks or N95 masks, which are referred to as N95 respirators. Those are critical supplies that must be continued to reserve for healthcare workers and other medical first responders, as the governor spoke of, as recommended by our current CDC guidelines. Remember, the best defense to COVID-19 is to stay at home. Please follow the guidelines. Take care of your health, both physically and mentally. And I'll read the hotline resources that I've done in the past. Hotline resources, 1-800-6264, and that's NAMI, 1-800-950-6264. The National Suicide Prevention Lifeline, 1-800-273-8255. Options for deaf and hard of hearing, 1-800-799-4889. Disaster Distress Helpline, 1-800-985-5990. The National Suicide Prevention Lifeline in Spanish, 1-888-628-9454. Veterans Crisis Line, 1-800-273-8255. Government employees can also tap into the Employee Assistance Program through our group health insurance by calling EAP line, which is 1-800-371-1125. You can also go to doh.vi.gov or text COVID-19 USVI to 888-777. I encourage you once again, follow the guidelines, stay healthy, and keep your family healthy. Thank you.
And now a word from our Senator Allison DeGazon.
Thank you, Governor. Warm Caribbean greetings to the people of the Virgin Islands. My condolences to the family in St. Thomas to the loss due to COVID-19. Thank you to Governor Bryan for inviting me to address the community as the chair of the Committee on Economic Development, Regulations, and Agriculture. As the chair of this committee, I continue to monitor our economy and look at what other Caribbean islands and smaller municipalities are doing to support and upkeep their agriculture sector, and what specific steps are taking to manage the economic implications of COVID-19. It is imperative that we provide a framework that offers a local stimulus and preparation for economic resurgence after this crisis subsides. In a recent meeting with the governor, I discussed two matters. One, local stimulus measures, and two, economic development after the crisis. A very important question to ask ourselves is, what would we have done if the ports were closed for cargo? How would we have been able to sustain ourselves if containers with food were not able to get to the territory? Virgin Islanders, this could have happened. Food is our basic need, and we must defend our food systems and the people who work in them. We have all seen stories about the heroic supermarket workers who keep the shelves stocked at the risk of their own health, so that the locked down populations can continue to eat. What we don't see are the small-scale producers working in remote areas far from the cameras, who continue to grow and provide food that is critical for local food security. Farmers and fishers are our heroes too. I continually rally for agriculture and fishing, and in doing so, I sought the governor and my colleagues' support for the use of $100,000 from the applicable funds to purchase produce from farmers for the Department of Education's No Child Goes Hungry program, and for the Department of Agriculture to sell back to the community, and to support several feeding initiatives that support our elderly. Funds will be deposited into the Agriculture Revolving Fund and managed by the Commissioner Positive T.A. Nelson and his team under their marketing program. And food will be purchased from registered farmers. This will greatly assist farmers whose normal business activities have been impacted by the COVID-19 pandemic. I am seeking to boost our fragile agricultural community and to make sure we feed our children and elderly, the most vulnerable sectors in our community during this critical time. The Commissioner of Agriculture and I put our heads together and came up with the option of having the farmers and agriculture vendors sell at the agriculture grounds on St. Croix. We received numerous communications and saw on Facebook that buyers were pleased and vendors were happy with the outcome as well. This will continue while we are under the state of emergency to keep the buyers and our vendors safe. On St. Thomas, the market will continue to be open at the Bordeaux site, located on the west end of St. Thomas. As we know, our small businesses are the backbone of the economy, and I'm elated that there is support for them during this time from Congress. I am asking, however, that every small business or independent contractor register for the Paycheck Protection Program, or PPP, which provides a pool of $349 billion in forgivable loans that small businesses impacted by the coronavirus pandemic can tap into to cover costs, including rent and payroll. Once you follow the guidelines of this program, your loan will be forgiven. This is a way to keep your doors open and keep paying your employees. As the landscape of the global economy changes from this virus, we must take proactive legislative steps to bolster the economy, and that time is now. We must identify the economic shortcomings and the opportunities this pandemic will provide us. We must nurture our economy and be ready to execute on behalf of the people of the territory. I ask you to stay home, stay safe, and stay informed. Thank you.
Thank you, Senator DeGazon. I also, before I open up to the phone lines for questioning, I would also like to say warm welcome to Oriental Bank, who already has a full-page ad in the paper today, asking businesses to take advantage of the same program, the payroll protection program that the senator just talked about. So they are actively looking for small businesses to participate and to gain access to some of those funds, which I know are needed more than ever in the territory. I also want to publicly give mine and my family's, the entire administration, condolences to Gary Malloy, our Commissioner of Labor, whose mom passed this weekend. To the whole Malloy family, our condolences go out to you, as well as to my good friend, former Senator Rocky Armando Liburd, whose daughter passed away last week as well too. So our prayers are with you. None of these two individuals suffered from the COVID, and we are a little distracted at this point from the normalcy of our community, even attending funerals. So this is a very rough time for families that are experiencing loss. So, this will be over soon, and we'll be able to do the memorials in their name. So God bless you and the families. Questions from the press? We have two questions. Go ahead. Remember to listen to the call, not to Facebook, because it's 15 seconds delayed. Go ahead. I can hear the line. Go ahead.
Good afternoon. This is Emily Matson with USVI News. I, too, would like to express my condolences to the family of the man who died from COVID-19 in St. Thomas. Governor, my question, I have a couple of them. First, can you talk a little bit about the airlines? I know several people are trying to get out of the territory, and many flights have been canceled.
Yeah.
Are all flights canceled until May, or can you address what's happening with that, please?
Not to my knowledge in terms of the airline flights that have been canceled. I think we have an American that is arriving every single day still. Spirit and Delta, as well as United, have canceled their flights into the territory. So, this is exactly what I was talking about at the beginning of this endeavor. We got to make sure people have to get out too. So American is the one airline that I know definitely is flying in and out of the territory daily thus far. We haven't received any notification from them otherwise.
Okay, thank you. My other question is, I know this morning there was a task force at a condo resort with the health department and police department. There was a large group of visitors from the states who had arrived. So what's being done about these places? Is there a task force that is trying to track this? And how challenging is it to police these places that aren't necessarily hotels, but Airbnb and Airbnb?
Yeah, I'm not aware of a specific task force, but I keep emphasizing to people, we are trying to track it. We've shut down the Airbnb booking system for the time period that we have closed. But remember, our main purpose of this was to stop the flights from coming, not essentially from making sure that the Airbnbs are closed. So while this is a minor issue for us, the major issue was making sure that we have less travelers traveling to the Virgin Islands, and we're seeing the results of that from our numbers. I don't know if our commissioner had anything else to add. Next question.
Thank you.
Good afternoon, Governor. This is Sean Pennington from The Source.
Hey, Sean.
I'm wondering if you could provide some further detail on what the intention is for, what closing the beaches is going to look like.
Yeah, so closing the beaches, that means that no one is allowed on the beaches at all for any purpose, whether it's jogging or whatever. The shoreline, let's figure just like how all public beaches are defined, 50 feet from the shoreline, the high water mark. No one is allowed to be in that area. We primarily want to keep people from congregating, holding picnics, or otherwise just getting together on the beach. We thought that it was the right thing to do. It's not going to hurt anybody. It's 2 weeks. We'll get through this 14 days and then come out of there a lot surer. We think we have a good handle on this virus at this point, and we want to keep it that way. So, like I said, we can't afford to have any flare-ups. And as we go through the thickest part, our peak is supposed to start somewhere around the 16th of May. We want to make sure that we're doing every single thing to ensure that we're not facilitating the spread of the virus. Other questions? That's it? One more question. Go ahead. You're live. Ask your question. Next question.
This is Sarah Burke with TV2.
Hi, Sarah.
The question. Hi, good day. How are you?
Good, good.
The question is as follows. Stimulus checks were scheduled to come out. What will be the process and when will residents be able to anticipate seeing these stimulus checks come through?
Well, the Treasury set a date of April 24th for them. We're saying we're going to have them out by May. We're still having people who have already filed taxes, they're going to get those rather quickly. If you haven't filed your 2018 tax or you didn't have a need to file your 2018 tax, we're figuring out a way for you to file a simple tax return, which is going to take a little while longer. For those people who have who are getting Social Security, we are already in contact with the Social Security Division, so you'll be getting your check through them as well. But we don't anticipate any problem for the majority of people who've already have their taxes in for 2018. It'll be calculated based on that income.
Thank you so much, Governor.
Thank you, Sarah. Next question.
Hello, good afternoon. Hi, this is the night at the San Correas. How you doing, Governor?
Good. How you doing?
Awesome. I just have two questions, one for you and one for the Commissioner of Health. What's the latest update on the plan for schools? Has that meeting gone forward? And then there's been a little jump in the suicide rate in the territory. There's been a couple in the last couple of days even. I think in the last 2 weeks there's been at least 2 suicides on St. Croix alone. And I know that in the period after the hurricane, our suicide rate jumped tremendously from what it had been previously. I'm wondering what the Department of Health, I know you have the Department of Behavioral Health Services and alcohol abuse and all that. Do you have a plan in place should the number continue to rise? Thank you.
We have, we're going to have the two things, thank you for reminding me, two things. We're going to have the epidemiologist on tomorrow to talk about all of the findings and the statistics behind who we found negative, who we found positive, as well as there is a release. You can find that on our website right now, Governor Albert Bryan on Facebook, vi.gov. Where you can see it's also on Department of Health websites, doh.vi.gov. Dr. Ellis has outlined where those cases were found and other demographics. Unlike normal trends, we seem to have more males that are getting the virus more than females. And then on school, we're going to have Commissioner Raquel Benjamin Berry on here on Wednesday, and she will be unveiling the school plan and what we'll be doing in terms of school for the rest of the year. One of the things that's making that plan a little delayed is that there's a significant amount of dollars that have been allocated through the CARES Act, which was passed by Congress, I think it was last week. So we're looking through that money and seeing how those availability of funds allow us to do a little bit more for students than we've done in the past, Commissioner.
Behavioral health. We've been saying that, that it's so important to not just care for your physical health, because your physical health is impacted by your emotional and psychological well-being. So we ask on a day-to-day basis that you actually focus on that as well. You do things within your home that can satisfy your well-being. Read books, look at TV, work with your children, your grandchildren, your friends. Think of virtual exercises that you can actually do. One person did a virtual party. There's so many different things that you can do, but depression is real, and that is what leads to suicide. So I ask you to look at your friends, look at the people around you, and try and see how you can help them. That's one of the reasons why I always report to you what the hotline numbers are. They will also be posted on the DOH website, so you can go there after today and look for them. Our Division of Behavioral Health and Alcohol and Drug Dependency have several programs so that you would be able to, the numbers will also be on a website. So please call Department of Health St. Croix or St. Thomas to get some more information. Agencies, we've had companies who have called us. We go out, we reach out. Of course, a lot of our conversations are now virtual, but we are willing to sit and help you. And yes, We have seen two suicides within a territory over the last 2 weeks, and I have been told we also have an increase in violence and domestic violence in particular. So it says you're staying at home, but are there things, some of the things that I think if you need help, please reach out and call someone. Thanks.
Other questions? That's it. Before I go, I'm going to have to say it again and again. I brought my water today, so I don't have to cough. But just stay home. It's a very simple thing. This is the easiest thing you've ever had to do. Just stay at home. I want to say a special blessing to the people out there who are going to miss their Easter service. I know you want to go, but get some technology, try to avail it. There are a lot of services on TV as well. And if there's a pastor out there that needs our help in getting out, we're willing. If you send us your service, we'll play it on the government access channel as well too. So doing everything that we can. I'd like to thank the commissioner for her continued leadership through this COVID exercise crisis, and the senator for working, and all the senators for working with us here in Government House to make sure that we utilizing every single tool to make sure that we not only fight the health disaster, but the economic disaster as well. I'll be back on Wednesday to talk to you again, update you, and give you any new information. In the meantime, stay safe, stay sanitized, and God bless you. Have a great day.
Buenos días. Como algunos de ustedes ya saben, hemos cruzado un umbral triste y desafortunado en nuestra lucha contra la propagación del nuevo coronavirus en las Islas Vírgenes Americanas. Me entristece anunciar que un residente de San Tomás murió en su hogar. Dio positivo por el COVID-19, lo que lo ha convertido en la primera muerte confirmada del territorio. Su desafortunado fallecimiento hace del territorio la última jurisdicción bajo la bandera americana a registrar una muerte por el coronavirus. El fallecido es un hombre de 85 años con condiciones médicas subyacentes. Sin saberlo, se encontró con un viajero que fue confirmado COVID positivo. Nuestras condolencias a sus seres queridos, ya que comprendo que este es, sin duda, un momento difícil para ellos y para todos en nuestra comunidad. Información sobre esta muerte se retuvo hasta tanto su familia fue notificada. Durante esta crisis debemos hacer todo lo posible por detener la desinformación. Previamente, hace varias semanas, hubo un informe relacionado al COVID-19 en Santa Cruz referente a un residente de State Prophet. Una prueba de autopsia comprobó su resultado como negativo. En otro incidente, se informó que un profesor de la Universidad de las Islas Vírgenes había muerto como resultado del COVID-19 mientras estaba en el estado de Kentucky. Todos los inicios sugieren que contrajo el virus después de que dejó el territorio y, por lo tanto, su infección y muerte están registradas en el estado de Kentucky. Finalmente, una historia hecha por el VI Consortium, publicada el viernes por la noche, alegando la muerte relacionada con COVID-19 en Santa Cruz, es errónea, razón por la cual este artículo fue eliminado de su página. Pedimos que el VI Consortium y otras agencias de noticias confíen en el Departamento de Salud para su información. La administración Brian Roach sigue comprometida con la transparencia y divulgación de información precisa. Por esta razón, nos disculpamos por un error tipográfico que fue publicado en el sitio web del Departamento de Salud que declaró mal el número de pruebas pendientes. Hasta la fecha, hemos completado pruebas en 283 individuos para COVID-19 en el territorio. 222 de esas pruebas dieron negativo. 43 positivos y tenemos 20 pendientes y una muerte. 36 de los 43 se han recuperado, lo que significa que actualmente estamos rastreando a 6 individuos en el territorio con el COVID-19. Actualmente tenemos un paciente positivo de COVID-19 hospitalizado en el Hospital Juan Francisco Luis y 2 pacientes COVID-19 hospitalizados actualmente en el Centro Médico Regional de Roy Lester Snyder. Uno de los pacientes en el Roy Lester Snyder está actualmente en un respirador. Quiero recordarles que si cree que ha estado en contacto con el virus, por favor, llame al 340-712-6299 o al 340-776-1519 y nosotros vamos a venir a usted. Por favor, no vaya a los hospitales a menos que se le indique, ya que esto pone en riesgo a otras personas en las salas de emergencia que buscan tratamiento por otras razones. Sin embargo, si necesita atención de emergencia, llame al 911. Toma esto en serio. El fallecimiento de este caballero el sábado por la noche es un triste recordatorio de lo grave que es este virus. Quiero que todos entiendan esto. Cualquiera de nosotros puede contraer este virus y cualquiera puede sufrir graves consecuencias para la salud y pérdida de vidas. Toma esto en serio. En su mayor parte, hemos hecho el bien como comunidad al seguir la guía del Departamento de Salud y el Centro de Control y Prevención de Enfermedades para ayudar a contener la propagación de este virus. Pero todavía tenemos algunos en nuestra comunidad que no están tomando esto lo suficientemente en serio. Tenemos un camino considerable antes de llegar a nuestro punto de contagio, que no se proyecta que estará aquí hasta dentro de 2 o 3 semanas. No podemos darnos el lujo de dar marcha atrás este progreso y como tal, hoy, a partir de hoy, estamos cerrando todas las playas del territorio durante 2 semanas. Esta orden permanecerá en vigor hasta el lunes 20 de abril. La Guardia Nacional de las Islas Vírgenes será desplegada para apoyar al Departamento de la Policía y al Departamento de Planificación y Recursos Naturales para hacer cumplir esta orden. El decreto de quédate en casa permanece vigente hasta el 30 de abril. Entendemos que este es el fin de semana de Pascua y normalmente la gente se reúne para celebrar su fe. Sin embargo, todos los lugares de cultos deben permanecer cerrados durante la orden de estancia en casa hasta al menos el 30 de abril. Aplaudimos a las iglesias y casas de culto que han encontrado maneras creativas que permiten a los miembros de su congregación seguir practicando su fe durante este tiempo de gran tribulación a través de la internet, radio, televisión y redes sociales. Las empresas esenciales pueden abrir en este momento. Por favor, recuerde, si usted debe salir, practique el distanciamiento social seguro. Hemos tenido vandalismo y robo en 3 de nuestras escuelas públicas este pasado fin de semana. Mientras los niños están en casa como resultado de esta pandemia, estamos apelando al público para que denuncie cualquier actividad sospechosa en los campus escolares y alrededores de ellos. Ahora que los hospitales están comenzando a ver un aumento de actividad, quiero tomar este momento para de nuevo agradecer a las enfermeras, médicos y personal de apoyo por el trabajo que están haciendo para salvar vidas y mantenernos saludables. Seguimos practicando activamente en conversaciones para garantizar que nuestros trabajadores de primera línea obtengan las medidas de protección necesarias para protegerse a sí mismos y a sus familias de la propagación del virus. La Casa Blanca se refiere a las próximas 2 semanas como el próximo momento 9/11 de la nación o Pearl Harbor. No podemos permitirnos un 9/11 o un Pearl Harbor aquí en este territorio. Así que les estoy haciendo un llamado para que hagan las cosas que les estamos indicando. Y por favor, quédate en casa. Si deseas recibir actualizaciones con referencia al COVID-19, por favor envíe un mensaje de texto a COVID-19 USVI al 888-777 para recibir todas las actualizaciones. Gracias.